first things you might remember about the baby, or the first thing you see is the hair that is full of, or the head rather, that is full of hair or not. And some of the things you will likely remember about the baby is the same. So yes, people have been judged based on their hair, the amount of hair that they have on their head, the amount of hair they do not have, their beards even. So that's why I said this is not just something for the women. This is also applicable to the men. Ladies and gentlemen, it's 5 minutes past 11 o'clock, and you're officially welcome to Soul Sisters right here on Smooth 98.1. To give you that introduction, I played you India Ari, that's the remix version featuring Akon, but originally it was just India Ari featuring Pink, which of course was an advocacy for hair, that you are not your hair. Are you your hair or not? We'll find out this morning. You can join us on YouTube, by the way. We are streaming live. It is youtube.com/smooth 91 FM Lagos. Again, youtube.com/smooth 91 FM Lagos. That allows you to view what is going on in the studio, to have a repeat later on, and most importantly, for you to be able to drop your comments using the live chat option. But if you'd like to see anything, you can come to WhatsApp too and drop your comments 0809 444 0981. Again, 0809 444 0981. To help us understand some of the things that we might have been doing wrong that are leading to hair loss, hair thinning, and the hair falling out, I have a hair transplant surgeon this morning in the studio with me, and his name is Dr. Emmanuel Eluba. Good morning.
Good morning, Sean. It's a pleasure to be here.
Thank you for coming straight out of surgery to be here.
Yeah.
And of course, going back to surgery, right?
Yeah.
Wow, we definitely should give a shout out to all of you who are constantly doing one thing or the other. All right, so let's get started. Like I mentioned, hair definitely has that association with self-esteem. There are people who actually, according to the report from Yale University, it says that people having bad hair days, not just that their hair is falling out, just having bad hair day, when you try to style your hair and it is not compliant, ladies can understand this. It has been associated with feelings of being less smart, feeling less capable, even more embarrassed. And there are days that you dress and you feel yourself and you just want to talk to people, you want to take pictures, you want people to see you. But on bad hair days, you don't want anybody to see you.
So, in fact, I would go a step further and say there was actually a study carried out in 2004, Williamson and et al. And, they got feedback from people who were experiencing alopecia. And it was amazing what they found was that the self-esteem or the quality of life of these people going or experiencing alopecia was similar to people experiencing severe psoriasis. So psoriasis is a skin condition. Um, you know, if I would liken it to something that we are more conversant with here in Nigeria, I'd say something like eczema. So you can imagine the impact of someone with severe eczema and liken that to losing your hair. So that was what they found. That females tend to feel exactly the same way.
That is so sad.
Yeah.
Okay, now let's start giving the solutions, because we don't just want to talk about the problem. We also want to help you identify the things that you might have been doing, what you have been doing wrong, and how to get out of the pit. So let's start with trying to nourish and care for your hair. You use different kinds of products. It's just the same way we had to discuss the issue of product overuse when it concerns skincare. So when it concerns hair care, you see this particular hair care product on the shelf of your friend. It smells nice. It has been shown to have 1001 benefits on the hair, and then you take it. You see another one, you take it. Now, what are those hair care procedures, or I don't know, routines that a woman can be involved in that actually might be doing the opposite of what she wanted to achieve?
Yeah. So when we talk of like damaging practices that people could be engaged in, I think number one thing that comes to mind is not even just the product, but your hairstyle. What kind of hairstyle are you making? Tight braids are the leading cause of what we call traction alopecia. So as the name implies, it's traction, it's pulling pressure on the hair follicles, and it's really quite common in Nigeria because and Africa as a whole, because I remember even back in primary school we used to have every week would have a different hairstyle, and they'll tell kids you have to get today is love in the basket, so the impact of having your hairstyle being changed every week, and it's not just being changed, it's being pulled very tightly, you know. And some people believe that if you do not come back from your hairstyling session with a headache, you've not achieved much. Some people really come with, so this one is quite personal. My sister, back when I was young, she used to come with her eyes pulled so much she looked,
Like a cat. You have the
so
cat eye
yeah, so
effect.
this is not acceptable. It's not a good practice at all. That's, I think, the number one thing that we have to change about hair care, because
Okay, before you go to number two,
okay.
just a quick break, and then when we come back, we will talk more about why you should not come back with a shiny forehead, which is a standard practice. Women understand this.
Yeah.
If the forehead is not shiny and having that cat eye look, it looks like you've not gone to the hairdressers. I remember one time I got my hair done, and I told somebody I just did my hair, and the person said, "Oh, sorry, I did not see any difference." Because it was not
There
pulled
was no
back.
shine.
There was no shine. All right, if you're joining us for the first time, you are listening to Soul Sisters. This morning, the topic of discussion is the woman and her hair. You can be a part of it at any point, but I will tell you later on the avenues for you to be a part of it if you're just joining. In the meantime, we will be right back.
Look, there's no easier way to say this.
Just a quick ad break.
So, if you want what's best, get the Airtel
So you can
Smartbox
pull
Outdoor
your
Unit
microphone
for
directly
SMEs.
into your mouth.
Okay, it's not loud enough.
Okay, so there's that effect
With an
that,
Airtel Smartbox Outdoor
yeah,
Unit for SME and
okay,
enjoy
that's
instant
good.
access to other amazing offers. Dial 1010 toll free or send an email to airtelbusiness@ng.airtel.com to get started. Airtel, the smart
Now,
phone
women always
network.
say our
Who
African
are
hair is
you?
difficult to
And
maintain,
why do
and
you
sometimes
think
we
you
ask ourselves
should be the
how our great
next
grandparents
Nigerian
survived
idol?
without
I'm
just a
21
natural
years of
precursor
age.
to
I'm a
music.
singer
Ah,
and
hey,
I have
let's
big
even start
dreams and I'm
the
ready for the
conversation
big
before you
stage
start the
and bright
questions.
lights.
Ah, let's hear you.
They
You
didn't
got
make
me
hair
at
that
my
often
first
those
glance,
days. I don't
staring
think they
at
Right.
did. I don't think they did.
you, staring at you, staring at
The
you.
music show of the year is back for its 8th season.
We have
Catch
to
all the
understand there's an
thrilling
increased
moments showing
consciousness
every
of how we
Sunday at
look
7
now.
p.m. on
And the
Africa
beauty
Magic
standards
Showcase.
have
Quite
changed over
different.
the
Fabulous. Stay
years.
connected to
Yeah.
DSTV and GoTV. Nigerian Idol is proudly sponsored by Biggie and Techno.
Let's take a critical look at your lifestyle and the state of your
We
health.
didn't have so much
With
silk
life in a
press
city that
and hot
hardly
hair
speaks, so many people
pressing like
working
we
hard
do
and many
now.
more on the edge, one thing is likely to happen.
No, I just even want to
Systems
focus on the
shut
most
down.
controversial, because if we get down to the
Helping
nitty
you
gritty,
discover facts
there's a
about
lot
your
that
health
We
people
won't
and
shouldn't
even
be
be,
expand
doing.
your
We
yeah.
won't be
access
able
to
to cover
well-being
everything.
through relevant
So when we
information.
come back, you
Tune in to
continue
Smooth
from
Health
where
on the
you
Drive
stopped.
Yeah.
and make that connection with your body.
There's some very interesting information I came across that I thought I should
The
share.
Smooth Health, every Thursday at 5:15 p.m.
And right now, you're listening to Soul Sisters on Smooth 98.1. It is 13 minutes past 11 o'clock. The show is about women, and not just women, but men on days like this, because hair is something you have on your head. And well, even though there are people who shave their hair, it might not necessarily be voluntary. It might be due to situations and circumstances that brought that on. So, how best you can care for your hair, and some hair care damaging or some hair damaging practices that you might have been involved in as a woman, was one of the things that we're talking about just before we took that break. My guest this morning is a hair transplant surgeon, and his name is Dr. Emmanuel Eluba. Before the break, we talked about traction alopecia. You pulling your hair back to get that shiny, I just got back from the salon feel. There is that thing that has to happen that
Mm-hmm.
everybody around must know you just got back from somewhere. But aside that, what are the other things that women do that can damage their hair?
Okay, yeah. So something else that is quite common, and this is quite recent, because we're seeing all sorts of developments in ways that people style their hair. Edge control, edge control.
No, you did
What
not.
else? Frontals. I've heard that so many times. So while consulting in the clinic at Vinci, lots of people come in, and all sorts of traction alopecia. It's not just tight braids. You're laying your edges. You're using edge control. You want to be on flick. I totally understand that. But how do you properly manage this? When you lay those edge controls and they dry off, and you don't let them dissolve properly, and you're combing the hair, that is an automatic recipe for traction. Okay, you're using frontals, you're laying your frontals. You use this wig glue, you know, and which is why we emphasize that you use professionals. You put glue on the frontal and then you fix it on, and when they're taking it off, not the same patience is applied. Sometimes it's yanked off, sometimes it's not properly dissolved, and so all of that. I'm not saying these things are outrightly bad, but you have to be extra careful when you're doing most of these things. What else? You're using chemical relaxers, texturizers, whatever you want to call it. Some people say texturizers are better, some people say, but at the end of the day, you have to use this product properly. I certainly personally do not advocate for use of relaxers. I understand that our hair is quite difficult to handle many times, and different people have different textures of hair, but there are lots of damages that come with the use of relaxers, with texturizers and such products. Even proper use of your shampoo and conditioner can, you know, contribute to hair loss. Many people don't understand that many shampoos are meant for application to your scalp. You know, you should be applying this to your scalp, not the tip of your hair.
Oh.
Yes. So many people don't understand that shampoo and conditioning goes hand in hand. How often do you shampoo your hair? There are studies that say you shouldn't over. I personally don't subscribe to that, but at least you should be shampooing your hair twice a month. Let's say every 2 weeks. That's fair. So all these practices are things that people should bear in mind. So consulting, I get so many of these complaints. I laid my edges, I yanked it off, and the hair is not growing. What do I do? So I would advise that you always go to professionals, understand really what you're doing with your hair, because your hair, look at it as a part of your body. It's an extension of you, and not just an extension. It's the crown. It's one of the most noticeable things about you when someone views you. So um, you should take care of it as you would other parts of your body.
Wow, that is so enlightening. I did not know some of the things you just mentioned. Thank you so much. I hope that somebody also is picking and gets in at least one new thing, and most importantly, that you will implement it. In the meantime, I think I would advise strongly the ladies to come through with their questions on WhatsApp 0809 444 0981. Again, 0809 444 0981. I say the ladies because the men are already sending in their questions. So if I were you, lady, I will quickly get the second row because the front seats seems to be filled up already. Then, if you want to call, it is 01448 9981. Again, 01448 9981. Still on those hair care damaging practices. According to data, we do have an increase, not just in women, but also in men. The dyeing, I mean, people dyeing, coloring their hair. What are the effects?
Okay, so hair dyes. This is also a very controversial topic because everyone wants to be in control of their look. Everyone wants to, you know, experiment, and we encourage as much as you can to have a very positive self-image. And if coloring your hair is how you choose to do that, that's fine. But then um, there was a study by a group called the EWG, Environmental Working Group. This is a non-profit organization, and they took about 100 and, if I'm correct, about 117 or so different kinds of dyes, and they studied these dyes, and it was found in the end that about 80 of the 117, 80 of those were literally had the potential to be carcinogenic, meaning they could go on to
Cancer.
cause cancer. Yeah. So that is something to have in mind when you're using dyes. Just a few pointers out there. There are some products or some ingredients in your dyes that you should look out for. And also, it's important to classify what sort of dye. There's the permanent dyes, the semi-permanent, and then there are temporary dyes. And also, we have artificial and natural dyes. So if you're doing something like henna, which is natural, pretty natural, um, it's still important to note that that could come with the risk of allergy. There are people that have serious henna allergies. So, always use a professional, always talk to, like, for instance, where I work, we give free consultations, and I can't stress this enough because we're not even charging you to come talk about your hair. We get lots of messages on Instagram, this. Just come and we'll talk about it. So, some of the ingredients, like I mentioned, there are people that use coal tar in dyes. Yeah, it's surprising, but if you don't go through these ingredients, you won't know. There's something called PPD, paraphenylene diamine, and these products are shown to be, the FDA has classified that as carcinogenic in animals. So definitely there will be huge risks down the line with humans. People use hydrogen peroxide, as we know, in dyes as as a way to bleach the hair, remove the color before you superimpose another color. So that in itself causes a lot of harm to your scalp. So I personally, I think a month or so ago, had a surgery I had to do, effects of hydrogen peroxide on the scalp. So it caused what we call scarring alopecia, caused a huge chemical burn on the scalp, and then obviously no hair growth there. So these are the things that you need to look out for. I'm not going to come out and say all kinds of dyes are bad or everyone doing dyeing, but it's up to you to decide.
Wow. Thank you so much. That's a lot to take in. And you can keep the messages coming to 0809 444 0981. Again, 0809 444 0981. I'll quickly take some and then go back to the questions. Cisco Delgado says, good morning. Well, good morning to you too. Thank you for listening. He says, if I were the only person on planet Earth, hairstylists and barbers will not be existing because I always shave my hair completely to popular Kodo style to function like a mirror. Basically, I do this because once there is hair on my head, I feel very uncomfortable and aggressive. Well, the woman can't do that. She needs to keep her hair, right?
Yeah.
So, yeah. But you're lucky, actually. At least it also means that you don't have to spend so much in the barbers. Then Muste says, oof, long one. So to begin with, he says, our women always say our African hair is difficult to maintain. And sometimes I ask myself how our great grandparents survived without this unnatural chemicals. Is this a mindset conditioned by our women, doctor?
Okay. So looking at this question, it's important to note that beauty standards are always evolving, and what applied to your great grandparents might not necessarily apply right now. But what is important is that you understand that there are healthy hair practices that you can use to maintain almost any kind of hair, no matter how difficult you think your hair is, which is why, as I said, consultations are important. You need to understand what your hair type is and look out for the signs of hair loss, for instance, so that you know when exactly your hair is going bad, when you're losing hair. So if you don't know the signs to look out for, you just be in the dark. So comparing it to our great grandparents, yeah, well, I think that the beauty standards might be different. What they did with their hair then is not what necessarily we're doing now. So
Yeah. And chances are that if a woman, now, as much as a woman also is doing this for herself to feel comfortable, because remember where we started from, how you look also says a lot of things about yourself. Now, as much as it's a controversial topic, they'll say people do dress or women dress or sometimes do cosmetic surgery for themselves. But at the same time, the men also are partly responsible. Would you feel very comfortable if you're married and your woman, has a certain kind of hairstyle on? That is just
well, so what I want to answer from a medical perspective.
okay.
It's very healthy to have a good self-image that is not imposed by anyone else or imposed by your partner. Has a huge role to play in how your self-esteem, for instance. But self-image has that prefix self
Mm.
because it's focused on how you, which is why it's important to understand the psychology of hair and understand that hair has a huge role, not just in how you look, but if you both, there's a religious undertone to hair, there's a uh, there's a social undertone to hair, there's a biological undertone. So from an evolutionary point of view, It's hair is the signifier of health, good health. So if someone has compromised health status, you can easily tell from their hair. It gets flaky, it gets thin, it falls off. So those are important things for. And then when it comes to, I'll give you an example. Here in Nigeria, um, we know that in some cultures, when you maybe go through an event that is particularly shameful,
Mm.
shaving the hair is the next move. For some people, maybe you lose a spouse, shaving the hair is. So there's a link between hair and honor. There's a link between hair also and femininity. So as a woman, it's very important that we pay attention to the psychological angles of hair.
So much to unbundle and unpack, and we do hope that before the end of the session, we'll have been able to do at least a bit of that because there is so much to talk about. Still, we hope that you're getting the right information and you are jotting things down. You're listening to Soul Sisters. The topic of discussion is about the woman and her hair. We'll go on a quick break, and when we come back, we will move over to the side of hormones and how they affect the hair because, of course, like Dr. Emmanuel just said, what is going on in the inside can reflect on the outside. And of course, your hair is one of the first place that you can see that, as well as your skin. This is Soul Sisters on Smooth 98.1.
This is Mr. C, and you're listening to Smooth 98.
You already answered the question, one of the other questions he has about what exactly we can do about hair esteem for
What are you
African
picking
women.
at? I'm looking to see
Yeah.
if I have a delivery. Have you checked
Court
inside
cases
the
about
bags
these
of the
hair
five
products such as
cement
Relaxers,
delivery?
Cosec. I think one of the reasons people just went for Relaxers is because it makes it easier for you to manipulate your hair. For instance, I have stubborn 4C hair that I cannot loosen and let go. So it's either I am stretching or I just keep it in braids.
Yes,
It's
but then,
stressful.
from my personal interactions with my clients, I understand that a lot of people forego the role of conditioner.
Oh, yeah.
Conditioners exist for like conditioning. So that's literally what it means.
Now I forgot one. Okay, so we'll start from that before we go over to the hormones. So you've mentioned some of the things that can be damaging, the things you should be on the
Yes,
lookout
and
for.
then
But
the
what are those things that
beneficial
are
things.
exactly?
We'll talk about those.
Because I think conditioner is one of them. But then again, what are the ingredients of the conditioner?
So that's such a wide,
Okay, just small,
That's
teeny
so-
tiny.
Dial 1010 toll free or send an email to airtelbusiness@ng.airtel.com to get started.
Okay.
Hi, this is Lettuce Seed, and you're on Nigeria's #1 station for soul, jazz, and funk. Smooth 98.1. Love music, love life.
Add intelligent talk to that, and you got the right mix. You're listening to Soul Sisters right here on Smooth 98.1. We are talking about the woman and her hair, and we have discussed quite a lot. If you're just joining us, don't worry, there is a recording for you on YouTube. You can still join the YouTube stream and wave at us. I'm waving at you right now. So it is youtube.com/smooth91fm Lagos. The channel is Smooth 91fm Lagos. You can also tweet at us on Twitter at Smooth91FM and use the hashtag SoulSisters981. WhatsApp is where you send your messages to. It is 0809-444-0981. Again, 0809-444-0981. While you can call 01-448-9981. Again, 01-448-9981. We have identified some possible things that you are doing that can have the negative impact on your hair. But what about those ingredients in your hair care products that could be helping you?
Okay, so first off, you have to understand that, as I said earlier, your hair is an extension and a picture of your health. So generally, good nutrition cannot be overlooked. You have to eat properly. You have to rest. Stress is also something that plays a huge role in, and stress is so difficult to quantify because stress is different for everybody. What stresses you out might not stress me out. So you have to identify what your triggers are and find a healthy balance to your life. But aside that, what are nutrients and things that I think also I have to talk about the role of conditioners. For instance, shampoo and conditioning should go hand in hand. I can't stress that enough. if you don't condition your hair, most of the things that you're looking for from texturizers, relaxers, there are things that could be achieved with proper hair care and use of shampoo conditioners. So, aside that, there are macro elements, nutrients that we could look out for. So, your hair product should contain things like zinc, for instance. Zinc is shown to be a very great nutrient for your hair. It aids the growth of the follicles and the oil glands around the follicles, so keeps it healthy. Also, you want iron to be a part of either your diet or your products, because iron stimulates and is an integral part of the production of hemoglobin, and hemoglobin carries oxygen, red blood cells, to all parts of your body, including your hair follicles, the blood supply to your hair. And what else? Biotin is a great supplement for hair. So biotin, which is vitamin B7, yeah, it aids production of keratin, and that basically is what hair is. So you want to ensure that these sort of beneficial products are part of your and all the vitamins, vitamin C, vitamin A, they are all important for your hair. So we've talked about things that are damaging. Once you ensure that these things are and you stop those harmful practices, you're
Yeah.
well on your way to having healthy hair.
Beautiful. Thank you very much for that. Now let's talk about the roles of hormones in how in the fullness of a woman's hair, in the thinning of a woman's hair, particularly. One of the reasons I would like us to talk about this is you see some women who had really full hair, lush, beautiful, dark, and then they had a baby and the hair just went away with it, and it's so sad. So, what are the, or what's the role of the, or the place or the impact of the female hormones on a woman's hair?
Yeah, okay. So first you say female hormones, and
Okay.
in medicine I don't know if we really have that term female hormones, because even things like estrogen are also in men,
Okay.
just not in the same amount, definitely. And things like testosterone, which is regarded a male hormone, is also found um, in women. But now hormones play a critical part, and if you look at even the term for male and female pattern hair loss, we call it androgenic alopecia, and we also have something we refer to as androgens. So androgens are hormones, and testosterone, or really a pro analog of testosterone, which we call DHT, dihydrotestosterone, is very much implicated in hair loss. So so for a woman now, talking about something like pregnancy, we know from studies that estrogen and progesterone levels are shown to rise in a steady fashion up until around the 35th week of pregnancy, and then it rapidly begins to decline. That decline is needed to stimulate, contractions. It's almost like preparing for the end of pregnancy. So estrogen is great for hair. The more estrogen someone tends to have, lush, beautiful, bouncy hair. But then it coincides with that decline, and then you begin to see pregnancy-related hair loss. So that is
Yeah.
one explanation for why someone would get pregnant, and because we all know what the pregnancy glow is, and that is largely linked to estrogen. It makes you glow, makes you look round, fuller, so it also affects your hair. But also, not just pregnancy, we um, we identify other times in a woman's life where she has a relative, I'll call it a physiological hormonal imbalance, meaning it's not pathological, it's not really a problem, which is puberty. So a girl that's going through puberty would start having those increases in estrogen, and these are responsible for secondary sexual characteristics, including growth of what we call hormone-dependent hair, which is terminal hair on the head, and the armpits, and other regions. So that is hormones typically play a huge role. So sadly, if there's a decrease in estrogen, it also facilitates an increase in DHT, which will cause, hair loss.
Wow.
So another situation where women go through this is menopause. Menopause just causes sharp decrease in production of estrogen, progesterone. So, and that is typically implicated with decrease in hair production, so hair loss basically. So, hormonal imbalance is something that you should pay attention to. As for what you can, there are also medications that you can take that actually cause hormonal imbalance and cause you to lose your hair.
Okay.
Steroid medication, you know, thyroid, something like levothyroxine, and people having underlying medical conditions like thyroid disease. So those things can affect your hormones and affect how it plays out in your hair, which is why I keep running back to consultations. Come to the experts. We know what we're doing. It's because you could be going through something and you're not even sure. It could be a temporary hair loss. It could be permanent. So you need the right diagnosis to even understand what is going on. So, for instance, an expert would push you in the right direction to know what hormones to get checked out, to know what underlying condition. But yes, hormones play a huge role in hair loss.
Wow, thank you very, very much. Cisco Delgado on WhatsApp says, okay, with the exclamation mark, saying, please, is that the reasons why people in Lagos State look older with gray hair due to stress that is part of lifestyle in Lagos State? Wow, that was not just a stray bullet, that was a direct bullet for everyone who is living in Lagos. But I like to think so, right?
Sure. We already established that stress is a huge implicator for hair loss. So yeah.
Digression. Why would somebody have, you know, gray hair? Why would somebody have gray hair before the typical age? I don't know how to frame the question,
So
but
what
you
is the
understand what I
typical
mean.
age for gray hair?
I don't know.
Because there are people that are old and still have a black. So I don't. Gray hair is not really. So it's linked really to what we call the melanocytes. They are pigment cells that produce color, and once they lose their pigmentation, so it's not really. Most times it's genetic, can be passed on. Most times it's. So it could also be stress induced, but it's not really linked to hair loss. It's not linked to hair loss, but gray hair, yeah. So it's those are the implicators, the melanocytes, what produces color for your hair. So when they run out of, and I think it's gene modulated. It's not really.
Yeah.
I don't know if there's stuff that you can do to stop gray hair from appearing.
And once you go gray, you never go black.
Well,
Sorry.
that's where our friends with the dye is coming.
It's funny, interesting, and complicated at the same time. So now that we have identified so many issues, what are the treatment options that are available?
Okay, yeah. So I always like to say, so this is important to state because we get lots of DMs saying, what cream should I use for my hair? I'm losing hair. What cream should I use? I saw this ad. It says I should rub this oil and all my hair will come back. So in the first place, what type of hair loss are you experiencing? Because if you do not make an accurate diagnosis, you're pretty much, it's not a one size fits all sort of thing. Hair loss could be very diverse, has numerous causes, as we've discussed most of the causes.
Yes.
So if you're having traction alopecia, I assure you that there's no cream that you're going to rub that would bring back your hair. So when it comes to treatment options, I'll just give you, I don't want to speak abstractly. I'll tell you what I do on a daily, and which are all available where I work. So we have medication. There's medication for hair loss. So there are FDA approved medication. Examples are minoxidil, so which is a vasodilator, increases the blood flow to the hair, and then so we apply that topically, and we have that available. So most times, people start experiencing hair loss and they think there are always solutions. So there's medications. So minoxidil, finasteride.
Oh, they're not things that people can just go and get.
No, they are not. Which is why I keep stressing. See, come around, have a consultation, and let's talk, because it's not. Well, it's quite difficult to find anyway, but still,
Okay.
but still, you want to get from the right sources, because we have special formulations. You don't want to just go out there and start using anything. Trust me. So aside medications, we have procedures that we do, including things like the PRP, platelet-rich plasma, where we take blood with centrifuge. We take out the plasma part of the blood, which is very rich in growth factors, something called VEGF. You know, uh, so it has growth factors. It has platelets, which stimulate blood clotting and improve growth. So we inject that directly to the areas of hair loss. That is an option. We have mesotherapy, a cocktail of vitamins and some other things that we inject to the scalp. So those are also there. We have laser caps,
Okay.
laser cap therapy, where we use just low level laser radiation to the hair. But this is typically for people that are just experiencing thinning of the hair, which is why early detection is key. You don't have to wait till all your hair has fallen out before you start looking for options. Yeah, and there are signs that you should look out for. If you are feeling your hair and it's the consistency is changing, you're beginning to see your scalp. You look at the mirror, you can see your scalp from the middle, and then it feels woolly. It feels like baby hair. That these are pointers that you've begun to lose hair. So what else? At the end of the spectrum is hair transplant. So that is the most definitive treatment for and the surgical option really. And so hair transplant is basically taking hair from the healthy donor follicles at a part of your hair where you still have hair and putting it in the bald area. So it's sounds pretty straightforward if you ask me. Yeah.
Okay, we'll take a final break, and when we come back, we will just be wrapping up with your questions, your comment, and every other thing you have to say about the topic so far, because we are almost at the end of it. If you're joining us for the first time, we have been talking about your hair. As a woman, well, if you have been listening, you will understand that it also applies to the men. And I have one or two questions to take that relates to the men. And you can also ask yours by sending it to 0809 444 0981. Again, 0809 444 0981. While you can start dialing 01 448 9981. This is Smooth 98.1. So those unrelated questions, we will just deal with them and wrap up.
Okay.
Well, not like they are not related, just digression.
Watch me, JJ, the chosen one, in the all-new Showmax original animation series, now available only on Showmax. Subscribe from 1,200 naira monthly. Sign up at showmax.com.
To run a
So,
business,
Demilade,
you need a plan.
I hope you're going to take out your hair
You
nice,
need a plan
easy,
to indulge in whatever
without
you enjoy.
damaging it. I remember
You
that
need a
Gorilla
plan,
Glue girl.
especially
Yeah.
on YouTube.
It was
You sure
crazy.
need a plan. Like the Airtel Super
Man,
Package
the
It was
things we
crazy
do.
that she went on to sue the company.
514 hash now.
And
Why?
she tried to sue them.
Oh, I didn't follow up with that one. Why? It was obviously her fault.
Yeah, she was saying something about it not expressly being stated that it's not meant for her.
What? She probably thought it was Gorilla Snouts,
Yes,
the gel
wax
or
thingy.
whatever. My hair, it don't move. It was crazy. Man.
So much to talk about, so much to say.
It's 5 musings at 5 on the Smooth Drive every weekday at 5 p.m.
On Smooth 98.
Only on Smooth 98.1. I think you should always be a part of it every weekday from 5 p.m. till 5:10, and then you get to catch the interesting, weird, quirky musings of Shokwe Martins. For instance, yesterday she was talking about people naming their cars. Who names their cars? That is weird. But yes, you should be a part of it later today. Right now, you're listening to Soul Sisters on Smooth 98.1, and we have been discussing the topic of hair. If you're just joining us, you are late. But don't worry, there is a recording for you on YouTube. This is the part where you start to ask your questions on WhatsApp, and you can also call 01448 We have only 6 minutes left, so you better hurry and get yourself a seat. I will go to this question from Musti, who said earlier, I cut my hair every 2 to 3 weeks and can't figure out how guys keep afro. That's so much work, keeping a comb to make it tidy. If I don't cut my hair, within that period, it begins to itch. Is that a problem? Is that frequency too much?
Okay, so itchy hair is quite typically if your hair is itching, you want to get it looked at.
Mm.
So typically, a dermatologist will be a suitable option for you to look at. But most common causes of itchy hair include dandruff, and even when your hair is just too dry, it tends to itch. It tends to flake and itch. So you want to, like I mentioned at the beginning, take care of your hair properly. You want to ensure that you're washing your hair and moisturizing appropriately. So your scalp does not need to be dry. It does produce some amount of oils that it needs to keep itself moist. But even your washing it off takes off those oils.
Mhm.
So you have to maintain a balance, ensure that it's well moisturized, and you should be fine. In some cases, it could be a scalp infection, like a fungal scalp infection, which there are lots of products available to take care of that.
In washing your hair, which is better, cold, hot, water?
Well, you don't want to burn your scalp, but anything, anything aside that, I would not. I don't think there's a preference for me personally.
Okay.
But you don't want to use water that's too hot, definitely. So, as long as you're not burning your scalp, you should be fine.
All right, then. Still on the topic of hair, well, maybe the one not necessarily on the head. Mistake says, is it wrong to shave the hairs on the leg? I don't know. That is beauty standard, I suppose.
Yes. So the way that the question is phrased, is it wrong? Like the moral issue. I think it's up to you.
Yeah.
If you like um, hairs on your legs, it's up to you.
All right, then. Here is Josh who says, please, what happens if the middle of the head is itching and what can I do? I think he
I
just
think I just
answered that.
addressed that.
All right, so 0809 444 0981 is a WhatsApp line, 0809 444 0981. And remember to add your name to that as well. And if you're calling 01448 again, 01448 And remember to turn down the volume of your radio set. Okay, we have talked about a lot, and is there any other thing to add before we say the final bye to today? I think everything has been said pretty much.
So I just want to reiterate that the treatment options are readily available, even down to people that are having I know we're focused on women today. Actually, this month is Women's Health Month, so we're focused on women, but we do everything down to beard transplants, and this one that particularly concerns women, eyebrow transplant. So people do not know that that this is a possibility, but yes,
Eyebrow.
yeah, exactly. So if you've lost your, maybe I don't know, maybe you were doing too much of what's it called, micro needling and all of that.
Interesting.
So yes, you can have eyebrows transplanted and it will grow.
Mm.
So yeah.
Very unrelated question. Well, no, it's still related. Just the beards that don't connect.
Which is exactly what I just said. You could have a beard transplant, you can make it connect. So there are even people that are going for if the transplant is not the route you want to go for, there's a patented procedure that we offer at the clinic, which is the MSP. An MSP is a microscalp pigmentation. So what is important for you to know is the range of options of treatments are there, and they're not just there in an abstract manner. They are available to you even in Nigeria, in Lagos here. So yeah, that's pretty much it.
Thank you so much. If there is anything you should take out, it is that whatever it is that you're going through in terms of hair has a solution to it.
Yes.
You just need to get to the root of it and meet with the right people. Always meet with the right people. Any situation, any condition, I don't know, anything. Just know that there is a solution for it, but it's important for you to seek out the right people for you to get the right solution. Else, well, you might be actually making things more complicated for yourself. Yes, there is treatment for bump, I believe. This is Clement British man. Yes, there is treatment for bump, even keloids.
Yes.
Thank you so much for being a part of this, and thank you for your messages and comment. Okay, I'll take this last one from Chidozie, who says, I know a lady who has a mix of gray and black hair. In fact, the gray is more than the black hair. She's in her early 30s and texture of her hair looks so rich and not breaking. Can we say there's still a problem with her hair? No, that was already addressed, I believe.
Yes, I addressed that. Gray hair is not necessarily an indication of a problem with your hair.
No. It's beautiful too. So yeah, I think it's one of the reasons people also bleach their hair for it to be gray.
Yes, yes.
So if you have your gray hair and it is healthy, nothing funny going on within you, I think you should just keep it and nourish it well. And of course, we have also mentioned some of those things you should be on the lookout for that can be damaging as well as nourishing. And importantly, pay attention to your nutrition at the end of the day. Catch this repeat on YouTube. It is youtube.com/smooth921 FM Lagos. My guest has been Dr. Emmanuel Eluba. If people want to catch you on social media, how can they do that?
Yeah, so my social media handle Eluba underscore EN, ELUBA_EN. I very much prefer that you catch me via my office, you know. So yeah, you could always check out Vinci Hair Clinic. We're on Instagram or everywhere. So
All right, then. Thank you so much. 11:55 is almost here, and that means you get to listen to the news with Olajumoke. And when she's done, I'll be playing you the beautiful soul songs on Strictly Soul. This is Smooth 98.1.